Hi everyone, my name is Caroline Branford, and my senior thesis is on the ACAN, aka the aggregate gene, inducing low blood supply to affected lesions in young people. What is osteochondritis dissecans? OCD, or osteochondritis dissecans, is also referred to a bone and cartilage condition that predominantly occurs in the knee. Before the lesion turns into a loose body, the lesion has to completely lose all blood flow, and when it breaks off, it creates a pocket, and this pocket is tender, and there's a lot of pressure being put on it, especially in the knee. How does osteochondritis dissecans affect day-to-day lifestyles, and what are the underlying mechanisms involved? I have a personal connection to this research topic because I have osteochondritis dissecans in my right knee. Lesions, also known as loose bodies, are areas of abnormal or damaged tissue caused by injury, infection, or disease. A lesion can occur anywhere in the body, such as your skin, in bones, in blood vessels, and other organs. Treatment of osteochondritis dissecans is intended to restore the normal functioning of the affected joint, but no single treatment works for everybody. Young people with osteochondritis dissecans have a higher risk of developing osteoarthritis later in life. Osteoarthritis is a degenerative disease which worsens over time after resulting in chronic pain. The ACAN gene provides instructions for making the aggregate protein. This is mostly the abundant proteoglycan in cartilage, a tough, flexible tissue that makes up much of the skeleton during early development. The aggregate protein is very important. Aggregate deficiency leads to increased prevalence of joint pathology over time, aka with the decrease of the aggregate protein in your body, you have a higher chance of developing osteochondritis dissecans. Among people with OCD, a gene identified as HTR2A is involved in the chemical regulation of serotonin. Serotonin derangements are the cause of several psychiatric disorders, including depression. 14 million people in the US with symptomatic knee osteoarthritis, symptomatic meaning showing symptoms. Over 3 million of those people are minorities, including Hispanic, Asian, Black, and other ethnic groups. Additionally, half of those with knee osteoarthritis were less than 65 years old. For men, there were about 836 per 10,000 affected versus 3,039 per 10,000 in women. This predominantly occurs in women. Physical health is evidently affected because you're not able to move around as much, but mental health may also negatively be affected as well. The recovery process after surgery, where you're on crutches every day, you can't do anything or you can't do too much, or you will reverse the surgery that was just done for you, is also a very, very tough battle when it comes to mental health in patients with OCD. Who is most susceptible to this condition, and how can it make them feel? Children and adolescents, like this young man right here, are more prone to developing this condition. Some of the symptoms of osteochondritis are, but not limited to, pain and swelling or giving out during activity. Juvenile OCD is where the patient is affected with open growth plates. I was told that I grew very, very fast. Quantitatively, 2 to 12% of the time, the elbow is involved in diagnosis of OCD. Although found primarily in athletes, this lesion can appear in any patient's most dominant arm. An example of a sport in which the arm is affected is baseball. Baseball pitching may produce excessive or repetitive stress against the trochlea. Bone bruises seen at the capitellum may be a precursor of an OCD lesion. Going back to the point where it says, although found primarily in athletes, this lesion can appear in any patient's most dominant arm. Most people are right-handed. I found out that OCD occurs predominantly, based on the statistics of it, on the right side of the body. So you can get right side OCD in your elbow, right side OCD in your shoulder, even in your knee, in your ankle. It doesn't matter. It mainly happens on the right side, but you can get it on your left side. So left-handed people are still at risk of being affected by this. Everybody is a situational cause. So in these pictures, we have an x-ray of the knee. This is an image of the femur. And this broken or this small piece right here is the lesion. The lesion holds the loose body, and as it's still connected to it, there's still a little bit of blood flow, but there's clearly a lack of blood flow because it is dying off and breaking off from the main source. In this picture right here, the medial condyle, which is 85%, and this is the lateral condyle, which is 15%. So more people have it in the pocket. This is the pocket of the femur. More people, ooh, so sorry. More people have it on the inside of the femur versus on like the tip of the bone or like on the outside. So this is the classical, or this is what mainly happens. This is a classical case where it's on the inside of the bone. This is an extended classical case, which is like a larger version of the classical case, and this is an inferocentral, which is right at the tip of the bone, and it's a 10% case situation. For the lateral ones, there is an inferocentral on the other side, which is a 13%. And an anterior posterior, which is in the back of the femur, that is a 2%. That is the least likely seen case in the doctor's office. 908 knees were used for this observation. Results included physical activity restriction, part of the reason why some people have mental health issues with this, muscle strengthening exercises, and physiokinestherapy. This is physical therapy. Physical instrumental therapies, weight-bearing limitations. Most jobs often ask if you can pick up 50 pounds or like boxes, bending down, and all of that. You can't do any of it. Immobilization. And the analysis revealed a wide range of healing rates from 10.4% to 95.8%, totaling 61.4%. A conservative treatment involving physiokinestherapy and possibly a restriction on strenuous sports and activities appears to be beneficial. This young man right here is sitting out, and even though his knees are crossed, he's not doing anything, so he's okay. This person is stretching or having their knee in a different position, in a more elongated position, because most oftentimes you can't keep your knee in one position at a time. This man probably doesn't want his knee to lock up. So he's finding another activity to do while making sure that he doesn't cause himself pain. My materials and methods were gathered by revealing data from previous studies not done by me, including genetic analysis, clinical reports, and experimental findings related to the Aiken gene expression and its impact on blood supply regulation. Analyzing data using statistical methods to determine the significance of the findings, and conclusions were drawn about the role of the Aiken gene in the observed phenomenon, which is osteochondritis dissecans. Negative prognostics factors were identified. The larger the lesion size, the more severe lesion stages. Resting your joint and taking time off and avoiding stress on the affected area is also proven to improve osteochondritis. I was also told that swimming and cycling are also great ways to alleviate all that stress on your knee. So this is a picture of swimming. For my results that I found, I found out that the Akin gene is upregulated or like more dominant in lesions with low blood supply in young individuals compared to healthier tissues. A similar condition called sporadic osteochondritis dissecans is associated with a single lesion in one joint, most often the knee. These cases may be caused by injury to or repetitive use of the joint, often sports related. For example, the baseball slide that I had in the other review of literature. Postoperative OCD. As you can see in the image below, part of it is before treatment with visible symptoms such as swelling, and point B is a more healed, healthier patient with OCD. And this is after medical intervention. You can see how drastically the size of the leg changes. In this specific picture, this is where the lesion was, very quite similar to mine. And this is after surgical intervention. I've also had screws implanted in my knee. For some people, if caught early, they don't need screws or anything, but for people with more severe cases, they would need screws implanted. To help improve osteochondritis dissecans or make a patient's condition better, they will need to be consulted for a magnetic resonance imaging or computerized tomography, aka MRI and CT scans. Some more than others don't always appear in these images. With these techniques, doctors can analyze these images from different angles, pinpointing precisely where the attention is needed and where to proceed. Resting, taking time off, and avoiding stress on the area has also proven to be a good way to improve osteochondritis. Orthopedic doctors may also have suggested wearing a knee brace to help with unintended strain. The length of non-surgical methods can take months from months to years from case to case. Not everybody's case is the same. And according to the Mayo Clinic, when preparing for a first-time appointment, list the recurring symptoms, note any injuries, and always ask questions. For example, always tell your doctor of unknown swelling, pain, redness, all of that, so they can help identify your cause because it can go overlooked for a very, very long time. Avoiding strenuous activity and doing alternate forms of exercise are also recommended by specialists, and it should be closely followed or advised. Further study on this topic is needed to improve treatment and inform more people about living with OCD. Attaining patients with early signs and prescribing physical therapy can help combat osteochondritis dissecans and prevent osteoarthritis later on in life. These are some of the references that I cited. I would like to express my deepest gratitude to Dr. Larry Lowe and Dr. Rush Oliver for their invaluable guidance, mentorship, and support throughout the duration of this senior thesis. Thank you for your time. Any questions?